we'll just mark where we're going to be doing the procedure, and then they'll give you anesthesia. You'll take a nice little nap then.
My name is Erasmo Perdomo. I'm 31 years old. I'm from Honduras, Central America, and in Honduras, I'm a health administrator. I work for municipality of San Pedro Sula, who is the second largest city in Honduras. 5 years ago, I had back pains and I was diagnosed with cancer. I went through 6 different diagnoses and 3 different biopsies. They said that it was a non-Hodgkin's lymphoma, but there are like 40 types of subclassification of non-Hodgkin's lymphoma, and they were unable to reach a final diagnosis. So my doctor asked me to look in the United States for an option to make a precise biopsy. And they also contact Mayo Clinic doctors. And so that's how I came here.
International services at Mayo Clinic, Florida is comprised of 2 distinct but relatable roles, one of them being international services, the other one being language services. Within international services, we have an international appointment office comprised of our intake team that manages all the appointment requests, as well as the medical review and the coordination of appointments. We also have international liaisons. We have a dedicated international nurse that triages all the clinical needs for the patients, as well as a finance team that's housed within our office. So in Mr. Perdomo's case, he came to us based on a suggestion from the local doctors in Honduras. After he's assigned the clinical team and created his itinerary, I come in contact with him as his liaison, and then I take over his care coordination throughout his complete episode of care from beginning to end. And I make sure that he gets what he needs, which in this case was getting a proper diagnosis to develop a proper treatment.
I am so excited for patients like Erasmo, because going in, as other teams tried to do through traditional open procedures to try to give them a diagnosis, led to not being able to give the patient a diagnosis. And today, thanks to the innovation and the technologies that we're using through minimally invasive approaches, through robotic surgery approaches, through keeping the patient awake, we were able to go in and safely be able to give the patient diagnosis. And in the past, without using these technologies, it was certainly a much more risky procedure that the patients would have to undergo.
I have read some articles in the webpage of Mayo Clinic, but I didn't imagine to be a patient of Mayo Clinic. It was my doctors who made the contact here in Mayo, and the experience has been very good. And finally, we have a final diagnosis, B lymphoblastic leukemia lymphoma. And my doctors are planning the best treatment for me. It's great to return to my country and think about being with my daughter, with my family, and to return to my normal life. And this is all thanks to the medical staff of Mayo Clinic.